This week, a crisis sweeping America. A public health emergency. Can technology help prevent drug overdoses and fight the opioid epidemic?
Manchester Fire Emergency.
A request for an ambulance in Manchester. It's the Shell gas station. The patient is in the bathroom. He is overdosed. 35-year-old male. He is not conscious, not breathing, overdose.
America is facing the worst public health crisis in its history.
It's a horseman of the apocalypse, and it's the one named death.
70,000 of its citizens are dying each year from drug overdoses.
I'm not doing nothing except sticking a needle in my arm every day, all day long. It's a waste of everything.
Around 3/4 of those are a result of opioid addiction. It's the #1 killer of Americans under 50, and it has reduced the average life expectancy.
We go out on these types of calls over and over and over again all day long.
Doug, can you get up?
By the end of this program, 3 lives will have been lost due to opioid overdoses. It's a crisis widely blamed on the overprescribing of pain medication, the addictive nature of which has left many turning to the street when their prescription dries up.
I was 16 years old and got my wisdom teeth out, and they prescribed Vicodin. And I was like, what is this miracle? These things are amazing. And in the end, I ended up being an everyday user.
Now, synthetic opioids like fentanyl, which can be 50 times stronger than heroin, and carfentanil, which can be thousands of times stronger, are being imported in bulk from China and cut in with heroin.
It's not heroin that's killing our people. It's fentanyl.
It's an issue affecting every corner of society.
Layla, wake up.
Again, fentanyl driving up into New Hampshire to pollute our communities.
President Trump has declared it a national public health emergency.
We will end this terrible menace. We will smash the grip of addiction.
Last year, the Food and Drug Administration and Congress pointed the finger at the tech giants for fueling the epidemic by not removing adverts for the illicit sale of opioids on their platforms.
Now, America's in the midst of one of the worst epidemics that it's ever experienced with this drug epidemic. But your platform is still being used to circumvent the law and allow people to buy highly addictive drugs without a prescription.
What we need to do is build more AI tools that can proactively find that content.
You've been said before you were going to take them down, and you haven't. And there's
Gentleman's
still
time has expired.
Well, his questioning was up, but we've got a whole programme, and we've given Nick Queck the whole show to investigate this.
I've spent the last few months looking at this hugely pressing issue, which is sweeping America. But what's important is that it's not just an American issue. We're beginning to see the full extent of this on our shores here in the UK, where apparently 1/4 of us are being prescribed potentially addictive medication. But in the States, I want you to look at whether or not technology companies really are contributing to the recent rise in opioid overdoses, or as technology companies, if their inherent nimbleness and ability to quickly innovate could actually provide an interesting solution to the epidemic.
Okay, and Nick's first port of call was an online forensics lab in the south of the USA.
At the University of Alabama at Birmingham, Gary Warner and his students monitor for illegal activity online.
So some of these students are investigating terrorism, some are working on financial crimes.
Their pioneering expertise in computer forensics have helped the likes of the FBI, the Secret Service, and now Facebook, the virtual home to more than half of Americans.
They realized that they had a problem with drugs being sold on their platform. We've been working to eliminate terrorism from their platform for some time, and I think we've taken the same approach. They said, what could you do to help with this?
Gary and his team have flagged thousands of websites to law officials that they believe advertise illegal drugs.
I browse social media platforms looking for people that are selling drugs on them. They usually comment on drug users' posts. In the comments section there will be people trying to sell them drugs.
Just one of us alone finds probably thousands of different accounts every day involved in some way, hundreds of different websites we go through. It's a lot to look at. I look at the worst parts of the internet. Like, that's our job. We're paid to do that.
There are research chemical is the term they use. Research chemical websites are selling the bulk fentanyl. On the social media, it is really more the people who are looking for an individual dose.
Savannah, what is on your screen there?
I have a lethal dose of fentanyl compared to a penny. It's 2 milligrams, is enough to kill a grown man.
What we're seeing is that a lot of what people are buying is a painkiller. They're going to a site that looks like an online pharmacy, not realizing that's not a legitimate pharmacy, and they're buying the drugs without a prescription, and they're having very successful dealings that way. And the problem is that when you get it, it's not a properly regulated drug. You don't know where it came from. When you buy a product online without a proper prescription from an illicit pharmacy, you're really rolling the dice with your own safety.
So you've been doing this line of work for a few years now. How much of this is work and how much of this is personal?
So, yeah, well, yeah, we'll go there. Okay. I lost my daughter to heroin. She was a troubled kid, and she got involved in heroin, and she actually committed suicide while she was high one night. She was 19. If this lab can help somebody else not lose their little girl or their son, that's a worthwhile cause.
Wow.
Yeah, when I asked Gary that question, I didn't actually know how close he was to the issue, him losing his daughter. But what I found is that a lot of people that are drawn to this line of work are personally connected in some way. They've either had family members that have gone through it, or going through it now, or they themselves have gone through it.
Okay, right. So we've established that social media makes it easier for people to find drugs. I'm assuming that Gary Warner's lab can do more than just flag up posts to Facebook.
Yeah, so users searching for drugs in America now on Facebook are redirected automatically to a government-run support website or helpline. But as Gary's team told me, with a lot of these adverts are appearing in people's comment sections or in private closed groups. They're not actively going to searching for drugs. These links just appear and they might click on them and be redirected to websites that sell the drugs. But with up to 500,000 comments being posted to Facebook per second, and the ability for people just to create new profiles to then advertise drugs online once their old ones are shut down, it's kind of an impossible task to keep up.
The platforms will shut them down, but they just get brought up under a different name. But I'm not sure if it's one person or a scam or a big organization, but they'll have about 15 or so different accounts run by the same person because they have the same phone numbers.
People used to sell Viagra on Facebook. Okay, well, you get rid of the word Viagra and a couple variants on it, and people said, oh, I guess I can't sell Viagra on Facebook, and they quit. The criminals, the drug users, the drug dealers are all getting very creative with how can I describe my product I'm seeking or my product I'm selling in a way that gets me around the censors. They've got O's in the middle where they're supposed to have zeros, so if you were searching for things by the dosage size, having the letters mixed in messes that up. There's just been this almost, we call it a keyword arms race. We put some terms in and Facebook begins to block them, so they use different terms, and then it just keeps going.
How many you got?
Oh, keywords, 1,695, and that's an older list. We probably have more than that, which just needs to be updated.
People are like, well, they should just hire more content moderators. And no, if you had an infinite number of content moderators, you'd almost need one for every person who's posting on Facebook. They've got to go after it in an algorithmic way.
Gary's team are developing software to automatically scour the web for fentanyl, a tool previously used for Homeland Security investigations.
And so if we go visit one of these sites, buy fentanyl pills between $200 and $980. Well, we didn't really look for that. We found it by the Bing Magic tool giving us a list of recommended sites that scored high for fentanyl keywords. The average user experience, it's harder to find drugs online than it's ever been before on these platforms. Is it possible still? Yes, it's always going to be possible. And if we multiplied by 100 the amount of money we spend, it'll still be possible because that's how Facebook scale works.
It's not only Facebook. Twitter has also come under fire for not removing public posts advertising illegal drugs for sale.
We don't need to have our social media promoting the use of illegal drugs on our children and our families.
Yes, I agree with you. This is unacceptable, and we will act.
Lauren Culbertson heads up Twitter's public policy in Washington.
We've taken down 17,000 tweets since we ramped up this work, and that number is growing by the day.
As well as deleting tweets, Twitter has partnered with the Drug Enforcement Administration on their biannual Take-Back Days, where Americans can safely deposit their unwanted opioid medication. They created a pill emoji and spread the word through hashtags.
Whatever the case, don't be the dealer.
Right now, we're actively working on a search prompt where people would be directed towards services. We're just having a few engineering issues, but we should be there soon.
So traditionally, Twitter is champion freedom of speech and doesn't want to get too heavy-handed with censorship. How much has Twitter had to change its policy with regards to the opioid crisis?
Well, illegal activity has always been against our terms of service, and so we enforce against that. As a lot of people appreciate, content moderation is really tricky, and you have to strike the right balance. And so while we want to enforce against illegal drug sales, we also want to make sure that we're not overcorrecting and censoring the people who are talking about and having conversations about the opioid crisis.
Yeah, and this is the problem they always hit, isn't it? The idea that they might start accidentally censoring useful conversations as well.
Yeah, so Google is actually facing a similar conundrum. They've been under pressure by the government to do more here, but by removing all of the search results for drug terms, they could be potentially masking life-saving information in the form of guidance or advice.
Yeah, but the tech companies are doing some good things, aren't they?
Yeah, for the last DEA drop day, and the next one's happening actually next month, Google updated its Maps product to include drug drop location, so people knew where to go to safely dispose of unwanted medication or drugs. Also, Amazon has updated its Alexa so that users searching for information about the opioid epidemic, the one search result they receive back, because you only get one answer on smart speakers, provides the best information.
Okay, Nick, stay there for a second. More from Nick after the latest tech news with Lara.
Hello and welcome to the Week in Tech. It was the week that a former Google engineer who worked with the US military program Project Maven called for laws to ban killer robots from war zones before they cause mass atrocities. American researchers claim an algorithm to spot Twitter bullies has 90% accuracy. The tool from Binghamton University could help social media platforms crack down on abuse. And a 4-armed robot surgeon is being launched into the NHS before an international rollout. CMR Surgical's bots have flexible joints similar to human arms. They'll help specialists complete operations using just a few small incisions rather than one big one. The US Air Force is adding smart gloves to its VR plane maintenance and operations training. The aim is to help staff really get hands-on. Made by Bebop Sensors, these gloves use powerful haptic feedback tech that lets wearers feel VR interactions with a 6-millisecond response time. And finally, this slippery underwater robot is actually meant to be rather scary, if you're a mosquito fish, that is. Made to look like a predator, it aims to frighten and tire out the invasive pests which wreak havoc on native wildlife around the world.
Right, so far, Nick, you've been looking at how social media is basically clearing up its own mess and policing the online sales of opioids on social media platforms. But there are new ways that new technology is able to help with the opioid crisis too.
Yeah, so the first thing I wanted to look at was, are there any solutions out there that can stop people from dying right now? Like safe consumption sites. That's places that people can go to inject themselves with drugs that they've got hold of elsewhere and use them under the supervision of healthcare professionals, so that in the event that they do overdose, staff can step in. They're not currently open in the US because some question the ethics behind them. They might not want them opening up in their neighbourhoods. But there are ongoing legal battles to start them up there. The one that we visited in Vancouver, Canada, called Insight, has been open for 15 years, and to date not a single person has died there. And that centre has actually been the training ground for a new smartphone system that tries to replicate the human supervisor, but using technology.
Okay, let's take a look.
Over in Seattle, researchers are developing an app called Second Chance that utilises the phone's microphone and speaker to automatically detect people on the brink of overdose.
The fundamental problem with opioid overdose is that people die alone, or they die with bystanders who are unable to recognize and help them. When people experience an overdose, they have dangerous breathing. And so the software is able to convert the phone into a breathing monitor. It does that by using the microphone and the speaker, and it turns it into a sort of a short-range sonar. So like a dolphin or a submarine, it's able to send out tones that can't be heard by you or I, but the reflections of those tones can be heard by the microphone. And those reflections can be used to identify breathing pattern.
The app will alert emergency services of the user's location when it detects dangerously low breathing, so they can report to the scene.
How effective is it? It was 97% sensitive for identifying people who had experienced this dangerous type of breathing. We think that using a device that most people already have is a way to reduce stigma. It doesn't identify you as having opioid use disorder because, you know, everybody carries a phone. The other thing that people often don't realize is that, you know, people with opioid use disorder, it's like a disease, and they still want to be safe when they are engaging in these high-risk behaviors.
Wow, okay, well hopefully that's an app that you'd never have to use. I mean, hopefully addicts will come off the drugs before that happens. What have you seen that might help in rehab and recovery?
So one of the problems that people face once they've come out of rehab, it's hard for them to stick to some sort of recovery plan. There's an app out there called We Connect which diarizes people's day so they can set routines and goals to achieve them. When they actually achieve the goals, then they can receive Amazon gift vouchers, so it incentivizes them to keep on track. The app also acts as a monitoring tool for clinicians to better keep tabs on their patients, so it lets them know where their patients are, how well they're doing, if they really have checked into the local clinic, if they really have gone to their therapy sessions, and also how likely their patients are to relapse, so then they can intervene sooner.
Another app called eMocha involves people videoing themselves taking their treatment medication, so they don't need to physically go to their doctors for directly observed therapy. They send their recordings through the app, and those are then verified by a healthcare worker, who also monitors their progress. The startup is also looking at rewarding users, but with some cash.
Over and above all this, there's the question of whether or not people actually will use these apps. When I spoke to Whit, who's in rehab, he thought otherwise.
You know, me being in full swing addiction out there, pulling out an app and using it, I think is probably a pipe dream. I'm gonna have to have something that's automatic that I don't have to do on my own, and if that's the case, man, that's really cool.
If you look at app retention in healthcare apps, and particularly mental health apps, it's abysmal. You're looking at a retention rate of around 5% at best after 60 days. And so what's happening is you're asking people to take effort to do something that they're already struggling doing. So take effort to engage in something.
The Centre on Addiction has conducted a study with Cornell Tech on how the way in which we use our phones can signify how susceptible we are to addiction and how likely we are to relapse.
We've found that sensation seeking is highly correlated with how often someone touches their mobile phone. It's correlated with the way in which people charge their battery in terms of the day, whether they plug it in during the day at one time, like at night, or if they charge it randomly throughout the day at different periods. So understanding these behavioral patterns is going to provide an opportunity for us to intervene with just-in-time interventions without someone having to do anything. We know that people disclose way more information to digital platforms than to humans. So people disclose more drug use, HIV status. Women disclose more sexual partners to a digital platform than to a human, and men disclose fewer sexual partners to a digital platform than a human. It's a good indication of where we are in terms of how we work with digital platforms.
The theory that people open up more to technology is being tested on the outskirts of Nashville, where a new form of therapy is being developed to make it more effective and accessible.
Tighten it up.
Noah Robinson is using virtual reality to better connect with his patients.
Get up here. All right. Can you hear me?
By meeting in a virtual world as digital avatars, Noah's found his patients are more receptive.
Yeah, what are the feelings?
The feelings are a little bit of anger, I guess. There's some sadness. I just feel crazy.
Whit's abusive relationship with drugs started at a young age, progressively getting worse, up to using opioids. One of the features of VR helping him make sense of his problems is the ability to draw them out virtually so he can better visualize and remember them.
Like, what do you think is the most likely explanation here?
This is completely untrue, and most likely all of these are going to be the ones that are the reasons why. Always amazed when I get here and step back and look at it all, how ludicrous it sounds in my head, and just to see it laid out it just all makes sense.
We're still in that exploratory phase, but what we're seeing is that patients are able to leave their current environment, which is kind of the context of where automatic thoughts and negative emotion is occurring. And when they come into the virtual environment, they feel more regulated, and it's kind of like this relief that they're able to experience.
No, it's just wild, It's wild. It immediately takes you into, I don't know, it just takes you in a different world right away.
So then if I teach them how to handle their automatic negative thoughts or their negative emotions when they're not actually experiencing them, it seems like it sinks in more effectively. And when they come out of the VR, they're then able to remember what I taught them and kind of visualize the model and things like that.
When I put that mask on, I'm immediately calmed down because I'm in a world that's so distracting. It takes me out of like the thought I've been obsessing about for an hour and a half. It takes the thought out of my head that's a real belief system at that time, puts it on the board, and I can kind of look at it.
This is just the beginning of trials. So far, it's a single effort, and Noah is yet to scientifically determine the effectiveness of his methods. But these initial sessions have proved promising.
It was actually much more therapeutic for me in virtual reality than I've been in the classrooms here.
Eventually, Noah would like to roll this out so people in recovery could receive virtual therapy remotely.
People who are going into VR on a daily basis, they're not becoming desensitized to it. It's not just novelty. They're forming real social connections and supportive relationships. And if we can take that and translate it to the world of substance use disorders and addiction, I think we could possibly make a dent in the opioid crisis.
The men here are only visitors. After a month of rehab, they're released back into the world. Having something like this that they could access from home could possibly help them stay sober.
Well, I really hope it works out for them. Okay, Nick, thank you so much. Brilliant reporting, really interesting, and I hope you found it informative and useful too. If you've been affected by drug addiction, maybe it's you, maybe it's someone that you know, help is out there. You can talk to Frank, which is the NHS's confidential advice service for drug addicts and their carers. The phone number is 0300 123 6600 and the website is talktofrank.com. You can contact us through the usual social media channels for anything else. Thank you very much for watching, and we'll see you soon.